So, good afternoon, everyone. I'm going to talk on do we need blood glucose monitoring in the era of continuous glucose monitoring? And this is the second part of the debate, and I'm going to speak on the notion against the notion. And my notion is no. That means what I believe is that we don't need blood glucose monitoring in the era of continuous glucose monitoring. Now, this is a quote from Professor Satish Garg. Professor Garg is considered one of the biggest name in diabetes technology, and he says that I would say in the next 5 years, if not in the next 10 years, sensors will take over from the glucose meter and meters will be thing of the past. Now, look at these things. The old telephone, the fax machine, the floppy disks, they are all obsolete. And just like that, the blood glucose monitoring will also be added to this list. The glucometers will be added to the list very soon. So why this will happen, right? Because I'll talk on each of these points. One, there is improvement in technology. The patient and human factors will see how CGM helps understand data beyond HbA1c. And finally, the finishing move, some very important clinical studies which have shown that CGM or FGM can replace blood glucose monitoring. So there's a common myth that CGM requires calibration with blood glucose monitor for accuracy. This is not true. Now let's look at the currently available CGM across the world. And Abbott Freestyle Libre and Libre Pro do not require calibration. Dexcom G6, the latest version of Dexcom, does not require calibration, whereas Medtronic Guardian Connect and Eversense, which is an implanted CGM, requires calibration. Two of the major manufacturers do not require calibration, and it will soon so happen that the other devices may also not need calibration. So with evolving technology, calibration with glucometer will be thing of the past, and you may soon have many more CGM devices which do not require calibration. Second myth, and this is a very common myth, CGMs are not accurate. Okay, so this is not true. Now there is a value which is known as MARD. MARD is mean absolute relative difference, and this is the most popular way for characterizing the measurement and performance of CGM and glucometer. And just to tell you, the lower the value, the better and more accurate the device. And not to be confused with the famous movie by Amitabh Bachchan. Okay, so this is a very poignant study which is done in 2017, where they compared the MARD of various glucometers which are available in the West. Some of them are available in India as well. And Contour Next, which is available in India, as well as Contour Plus One, had a MARD value of 5%, right? You can see this chart over here. Most glucometers had MARD values of between 5 to 20%, but more than 50% of them had a MARD value of greater than 10%, right? So basically what I'm going to tell you is that glucometers also are not very accurate per se, right? And this difference remains, right? And look at this MARD value of CGM devices, and Dexcom has 9%, Guardian has 9.6%, Libre has 9.7%, and Eversense has 8.5%. So most of them play around the range of 8 to 10%. So what you see is that the CGM devices have a MARD value which is less than 50% of the glucometers. So what I'm trying to point out is that actually CGM devices are probably as accurate or more accurate than your blood glucose monitors. So most current CGMs are accurate, or probably you can say inaccurate, as the BGM devices. And remember, this new movie, it's a great movie, go watch it. It's called Mard Ko Dard Nahi Hota, right? So there you go. Third myth is that FDA does not allow adjustment of insulin based on CGM value, and this is not true. This changed in December 2016, where FDA expanded the indication for use of CGM to replace fingerstick testing for treatment decisions. And this is what the FDA says, that monitoring devices can replace fingerstick glucose for testing for diabetes. And this is the Guardian was the first approved device used to make diabetes treatment without confirmation with a traditional fingerstick. So earlier it used to be that you had to, first take the reading using a CGM, and then you had to confirm it with a blood stick measurement to really get the accurate value, and then you can take the treatment decision. But this is not so anymore. In fact, the study Replace BG trial was actually done to see whether you can replace continuous glucose monitor the blood glucose monitor with CGM for treatment decisions in well-controlled type 1. And what they found was that CGM without use of confirmatory BGM is as safe and as effective as CGM with BGM in well-controlled adults with type 1. Now let us look at patient and clinician factors, right, and why continuous glucose monitor is very effective from these parameters. So a question was asked in a survey: how frequently does your patient check capillary blood glucose? And what is seen is that in the United States, in type 1 patients, about 1,000 patients were surveyed, and only 40% of the patients check their sugars more than 5 times a day, which is what is best thing to do. And there were about a 20% who had checked less than 3 times a day. If you see type 2 patients, majority did not check less than 3 times a day. So you can see that the frequency of blood glucose monitoring is very, very, very low than what we like. And this is from 2 very important studies. We'll come to that in a few minutes. The IMPACT trial and REPLACE trial. And what they found was that when patients were asked to do SMBG, they on an average did about 3 to 6 tests in a day. But when a Libre Pro was applied, they checked about 8 to 15 times in a day, right? So, you can see the difference here. Clearly, there is a needle phobia here, and patients check more frequently with, the Freestyle Libre Pro or Libre. If you see, this study which was, discussed in one of the recent conferences, and what they actually found was that expanded real world confirms that the frequency of flash glucose monitoring is much higher, right? Checking is much higher, and what they found is that there was higher rate of scanning due to self-monitoring glucose associated. It was associated with better, improved glucose measures, including better, time spent in time in range, as well as hyper and hypoglycemia wellness. So, better monitoring means that clearly an increased compliance of patients is seen with CGM, and higher rate of glucose monitoring clearly means better patient outcomes. Does it improve the quality of life? And this is the bottom line here, right? So again, this is a study which is published where they compared the actual quality of life and risk of hypoglycemia, and you can clearly see that there was a reduction in risk of hypoglycemia. And what they found was the frequency of hypoglycemia, HbA1c, and worry that it will produce hypoglycemia increased the behavior and quality of life, and ultimately the flash glucose monitoring reduced all these parameters, right? Again, let's see if you can go beyond HbA1c. So let me show you 2 cases. Now, this is case 1. His HbA1c is 6.6%. His average sugar is about 144. There's a second guy. His average sugar is again same, 145. Again, his HbA1c is 6.6%. So both technically have good glycemic control. But look at the graphs. Look at this and look at this. And you can clearly see that the patient 2 has a very high glycemic variability. So are these 2 patients the same? This is a study by Ramachandran, and they found that glycemic variability actually is a very important parameter and helps predict hypoglycemia in both type 1 and type 2 patient. And HbA1c was at best a weak predictor of hypoglycemia, whereas all the indices of glycemic variability taken from the CGM were actually much better predictor. Again, this is a study which was done by Lu et al., where they found that the time in range parameter measured by CGM helps to predict the risk of retinopathy, and the lower time in range by CGM was associated with increased risk of diabetic retinopathy. So if you spend lesser time in range, you are more likely to develop diabetic microvascular complications. Again, you can see the division of the data, and you see our beloved chairperson of the organization is going to say that he today asks all the patients that, boss, what's your HbA1c in 2019, but 10 years down the line he's going to say, what's your time in range, right? So time in range is a very, very important parameter. And just to finish the moves, let's look at some very important clinical studies which have compared the 2 things. And one is the REPLACE BG trial, and this was a randomized controlled trial where continuous glucose monitor was used in one set of patients, and another set of patients CGM with blood glucose monitoring was used. And it was the idea was to see whether CGM can completely replace a blood glucose monitoring. So the use of CGM without regular use of confirmatory blood glucose monitoring was found to be safe and as effective as CGM in a well-controlled type 1 patients. Okay. Then there's a second study which is known as IMPACT trial, which is basically novel glucose sensing technology and hypoglycemia in type 1 patients using CGM versus VGM. The intervention group used continuous glucose monitoring, the control group used blood glucose monitoring. And you can see from this the HbA1c was clearly, in the intervention group was found to be lower the hypoglycemia is compared to be lower, while the HbA1c was the same in both the groups. So at equipoise HbA1c, use of CGM was associated with lower risk of hypoglycemia. And if you see again time in range, clearly patients, the mean glucose was similar in both the groups, but the time in range, time spent in normal range, and hyper and hypoglycemia were actually much lower in the intervention group. So what they found was that there was a 38% reduction of hypoglycemia in the intervention group. So those who used CGM, they had less risk of hypoglycemia. And finally, the finishing move, right? So this is a blog post from our referee Parthakar, and he talks about Libre, and why NHS should fund for Libre, and these are some of his Twitter posts and also news articles on the same. Basically, the referee is on my side. Thank you.